Today, we're looking at two of the most talked about tools for weight loss: intermittent fasting and Ozempic, a medicine whose active ingredient is semaglutide. This summary is based on the article Intermittent Fasting or Ozempic, Exploring Their Impact on Weight Loss and Metabolic Health by Sharmin Naz, published in International Physiology in 2025. The obesity problem. Overweight and obesity have become major health problems, especially in India, where more than half of the disease burden is linked to unhealthy diets and lifestyle. Highly processed foods, sugary drinks, physical inactivity, and limited access to healthy meals all contribute. Obesity is strongly connected to diabetes, fatty liver, heart disease, sleep apnea, and many other conditions. Because of this, researchers and doctors are searching for methods that are effective, affordable, and acceptable for long-term use. Two popular options are intermittent fasting, a diet pattern, and Ozempic, a medicine originally created for type 2 diabetes. What is intermittent fasting? Intermittent fasting means cycling between periods of eating and not eating, without always changing what foods you eat. Common patterns include 24-hour fasts or alternate day fasting, where you fast one day and eat normally the next. The 5-2 diet, with 2 low-calorie fast days and 5 regular days each week. Time-restricted feeding, like the popular 16-8 plan, where you fast for 16 hours and eat all your meals in an 8-hour window. Because people only change when they eat, not necessarily what they eat, many find this easier to follow than traditional calorie-counting diets. Effects of intermittent fasting on weight and metabolism. Studies on different fasting patterns usually show weight loss between about 2.5 and 10% of body weight, along with loss of body fat. Alternate day fasting and the 5-2 diet have repeatedly produced meaningful reductions in weight, waist size, and visceral fat. Intermittent fasting also improves many metabolic risk factors: better blood sugar control and insulin sensitivity, lower blood pressure, improvements in cholesterol and triglycerides, reductions in inflammation markers and liver fat. These benefits make fasting a promising strategy not just for weight loss, but for preventing or managing conditions like type 2 diabetes and non-alcoholic fatty liver disease. Brain health, aging, and how fasting works. Emerging evidence suggests intermittent fasting might also support brain health and healthy aging. Animal and early human studies indicate improved learning and memory, reduced brain fog, and protection against degenerative diseases, possibly by stimulating a process called autophagy, the body's way of cleaning out damaged cells. Mechanistically, the temporary calorie deficit and mild stress of fasting activate protective genes, enhance fat burning, and improve the body's ability to handle oxidative stress. Over time, this may slow down some aging processes and improve overall resilience. What is Ozempic and how does it work? Ozempic is the brand name for semaglutide, a long-acting GLP-1 receptor agonist. It mimics a natural gut hormone that increases insulin release after meals, suppresses glucagon, slows stomach emptying, and acts on the brain to reduce appetite and increase feelings of fullness. It was approved to treat type 2 diabetes and later used at higher doses specifically for weight loss. Clinical trials show that weekly injections of semaglutide can lead to substantial weight loss, often far greater than with lifestyle changes alone. Participants in major STEP trials lost a significant percentage of their body weight and also showed improvements in blood sugar and HbA1c, blood pressure, cholesterol and inflammatory markers, Risk factors for fatty liver disease. Side effects and limitations of Ozempic and fasting. Ozempic is generally effective, but not free of problems. Common side effects include nausea, vomiting, diarrhea, and indigestion. More serious but less common issues can involve gallbladder disease, pancreatitis, and, in some reports, bone or lean mass loss. Weight regain after stopping the drug, sometimes called Ozempic rebound, is also a concern if lifestyle changes are not maintained. Intermittent fasting is not perfect either. People may experience hunger, fatigue, irritability, headaches, low energy, difficulty concentrating, and social inconvenience around mealtimes. Fasting isn't recommended for pregnant or breastfeeding women, children, people with eating disorders, or certain medical conditions without medical supervision. Comparing intermittent fasting and Ozempic. Both approaches reduce appetite and calorie intake, but in different ways. Intermittent fasting uses meal timing and longer gaps without food to trigger fat burning and hormonal changes. Ozempic acts pharmacologically on the gut and brain to reduce hunger and slow digestion. Both improve blood sugar regulation and metabolic health, but fasting offers additional potential benefits for cellular repair, brain function, and longevity, while Ozempic provides a strong medication-driven effect, especially helpful for people with diabetes or severe obesity. The article concludes that intermittent fasting may have an overall edge as a long-term lifestyle strategy. It's low-cost, non-drug-based, and linked to broad health benefits with generally milder side effects. Ozempic, on the other hand, is a powerful medical tool that can be extremely useful when carefully prescribed and monitored, especially for those who struggle to lose weight with a lifestyle change alone. Final take-home message. In summary, both intermittent fasting and Ozempic can lead to meaningful weight loss and better metabolic health. Fasting is a flexible, lifestyle-based approach that may also support brain health and longevity. Ozempic is an effective medication that significantly reduces appetite and improves blood sugar, but it comes with cost, possible side effects, and the risk of weight regain if habits don't change. For anyone considering these options, the safest path is to discuss them with a healthcare professional and choose a personalized plan that you can sustain for the long term.